Thank you, Matthew and Andrew, for the great presentation. So briefly now, I will introduce WHO's document that has been launched today titled The Summary of Recommendations for Quality of Care in Cataract Surgery Management. So this is intended to be a very practical document for governments, planners, NGOs, other stakeholders who are involved in implementing cataract surgery on the ground. I wanted to frame this going back to the global target. Matthew spoke earlier about this global target and how we're tracking towards achieving this target. And what I wanted to highlight is, of course, that as countries set out to strengthen cataract surgery, as we go towards achieving this target, both components of access and quality are extremely important. And this was particularly highlighted the importance of quality in the Lancet Global Health publication, which found that on average, the relative quality gap, and which was the difference between coverage and effective coverage, was 36.7%. So that basically means that approximately 1/3 of people who underwent cataract surgery do not currently have a good quality visual outcome. But as we saw from Matthew's results earlier, that if we add up the number of people, the proportion of these cases that were due to needing eyeglasses post-surgery, plus intraoperative complications, plus the need for laser surgery for posterior capsular pacification, the majority of these cases could be implemented in terms of addressing the quality issue. In fact, it's around 60% of these cases could be addressed with these interventions. So what this does highlight is that where the delivery of quality cataract surgery remains a challenge, there really is a very good opportunity to improve effective cataract surgery coverage, often through measures that do not involve, I should say, significant additional investments. So although the measure of effective cataract surgery coverage captures an important element of quality, which is the effectiveness up the top of the diagram up here, there are other important components of quality that must be considered in the planning for cataract surgery management. And they include things like safety, people-centeredness, timeliness, equity, integration, and efficiency. And with this in mind, and in order to support countries and other stakeholders with guidance in this area, WHO, through consultation with a large group of international experts, developed this summary of minimum quality standards of care in cataract surgery management. So what is it? It is an evidence-based and expert-agreed recommendations for improving quality of cataract surgery that's applicable to most settings, and in particular, low and intermediate resource settings. It covers the three main phases of cataract surgery, including the preoperative care, intraoperative care, and postoperative care. What does it include? It includes recommendations for the quality of care across 7 key components of preoperative care. I won't go through all of them, but these include things like recommendations around preoperative assessment, waiting time for surgery, recommendations about the use of optical biometry, IOL availability, and also selection. It also includes 7 key components, recommendations around 7 key components of intraoperative care, including things like the surgical technique, infection control, intraoperative complications. And lastly, it includes 4 recommendations around 4 key components of post-operative care. And it includes things like intervals recommended intervals around follow-up visits, recommendations around what designates a good outcome, what proportion of the population we should be aiming for that should achieve a good outcome, and also recommendations around post-operative complications. Who is the target audience for this document? The primary audience is policymakers and planners that are responsible for developing protocols and policies around cataract surgery, but also managers of eye care programs within countries. There's several other potential end users, including eye care service providers, to put into action the recommendations at a facility level, health professionals to verify or align the care provided with these standardized evidence-based clinical care recommendations that have been extracted from high quality existing guidelines. and also donors and development agencies when supporting cataract service provision within low and intermediate resource settings. So as I said, that's just a very brief overview. I encourage you all to go to the WHO webpage. We can put a link to the document in the chat here so you have access to the document. Before I close, I wanted to acknowledge the huge number of experts that are listed on the screen here from all regions that were involved in supporting WHO with the development of this guidance. A couple of special mentions to the Dana Centre for Preventative Ophthalmology that were responsible for doing the formative work of the review of all of the existing guidelines and synthesizing all that to support WHO in the next phases of development. Also, the working group within IAPB responsible for cataract, who we liaise with throughout the development, that was in fact led by KT, who will be joining the panel discussion soon. And last but not least, really a big acknowledgement to the Fred Hollows Foundation for the generous financial support provided towards the development of this document. And with that, I will stop, pass back over to you, Matthew. Thank you.